The ovary in women is responsible for two things: the release of estrogens, which takes you through puberty and gives the female form, breast development. And it's also responsible for your fertility. And the fertility, of course, has the menstrual cycle, the ovulation cycle, and during the menstrual cycle you will have a period, or what we call menses. The commonest ovarian condition we see is something called polycystic ovarian syndrome. When we call something a syndrome, it usually means we don't fully understand the mechanistic basis that underlies it. But essentially, about 5 to 10% of women may have polycystic ovaries. That is, they have multiple cysts in their ovaries, and it's associated with irregular periods. If it's severe, it can be associated with infertility, and it's also associated with a slight increase in androgen or male hormone levels in women, which can cause things like hair on the face, or we call it hirsutis.
PCOS, or polycystic ovary syndrome, represents a leading cause of infertility in women. More or less 40 to 50% women having infertility, they have PCOS. The ovaries, they don't work very well. First, because they produce a large amount of testosterone, and second, because they do not produce eggs. This means that these women sometimes they need assisted reproductive technology to conceive.
Polycystic ovarian syndromes can run in families, and we do believe that there is a genetic basis, but it's probably not one gene, it's probably a combination of genes, which makes it difficult to define.
The best way to prevent PCOS, even in women having the susceptibility because of genes or something else, during adolescence should be to maintain and to keep body weight in the normal range.
For the majority of patients with polycystic ovarian disease, they're quite simple treatments to help. Of course, if irregular periods are common, then you can take some form of estrogen replacement, which can make the periods more regular. Depending what the problem is, if somebody has problems with excessive hair on the face, then we also have treatments for that. And if people have infertility, again, a lot of the modern treatments now are able to help people become fertile despite having polycystic ovarian syndrome.
We have different treatment according to the problems of a woman affected by PCOS. One problem is a lack of periods or very few periods during a definite period of time. The best way to improve periods per se is to use oral contraceptive. Generally speaking, all contraceptive can reduce testosterone levels. And no doubt that this is a good way and a very safe way to improve and to have regular menses. The research focused on many possibilities: genes, intrauterine factors related to the susceptibility to have PCOS later in time, or adolescent factors possibly responsible for the development of PCOS. And among these factors, the most important one, the well-defined, is the presence of overweight and or obesity.
Polycystic ovarian syndrome is a very common problem that patients have, and the European Society of Endocrinology is very keen to address this. So specifically, we've started a special interest group, which is actually led by the president of the society, to look at new treatments and the underlying mechanisms or genetic basis for polycystic ovarian syndrome.